Hello, everyone, and welcome to another insightful episode of MedSynapse podcast series. I'm your host, Hedvi Shah, and today, in an era where technology is transforming every aspect of our lives, healthcare is no exception. So, digital health has reshaped the way care is delivered, connecting patients and providers like never before. But with innovation comes challenges and the need for strategic navigation. So, today we are thrilled to explore the world of navigating change in digital health with Dr. Neelesh Bhandari. Dr. Neelesh combines his medical expertise with a deep understanding of digital health strategy, offering an unique perspective on how technology can revolutionize healthcare delivery. So, Doctor, it is such a pleasure to have you here and thank you for joining us.
Thank you, Hetvi. A pleasure being here.
Doctor, before we dive into the main topic, could you share your entire professional journey with us?
Sure, Hetvi. I'm a graduate of Armed Forces Medical College, did my MBBS from there, worked as a GP for around 10 years and did my MD in Pathology. Post my post-graduation, I shifted to technology, launched two startups, social media, remote patient monitoring, patient engagement. I worked as the head of doctor relations at Practo, at another Amazon-funded company. Overall, I've been in as a clinical practitioner for 10 years and in the healthcare technology field for the last 15 years.
Yes, I think that's a vast
So
experience that you have, especially in digital technology, Doctor. Uh, Doctor, let's
it's been
start with
interesting. Been
yes.
very
So, now in your view, how has the evolution of digital health reshaped healthcare delivery? So, and are there any specific changes that stand out to you as game changing?
But the real changes really started when technology started getting widely used in healthcare since, say, 50s or 60s. When you first started having use of telemedicine and telemedicine, I mean at that time is taking consultations on phone. That was the first form of telemedicine. Even before that, another form of telemedicine was when people were transmitting ECGs by fax machine and taking opinions from cardiologists far away. So even that was a form of telemedicine, 50s and 60s. But what today I see as the most important changes which have occurred as a result of widespread use of technology in medicine is it's more patient centric. Uh, Patients have now improved access and convenience of getting healthcare from wherever they are, or even if they go to an organization or a hospital, the efficiency with which they get care is much better. Appointments, even in our government hospitals like AIMS, have become online. So getting appointments and the waiting time has reduced so much, where we initially thought of going to a hospital would take almost the whole day. It was a full day program for most families to go to hospital and take care. But now, even in rural areas, I've seen people can actually take, when they come to AIMS, they actually take appointments. They come on the day of the consultation, get the consultation, and they can go back home by evening if everything is okay. That level of convenience and that levels of savings people have started doing now is phenomenal. It was unthinkable till a few years ago.
Hmm.
Home delivery of medicine, lab investigations we get done at home. People get their ECGs and now even X-rays done at home. So this level of convenience where you don't have to go out for any of your primary care at all. From telemedicine to your diagnosis to your delivery of medicine, everything taking care at home has been huge.
True.
Telemedicine stressing a lot, which actually has been a game changer in the public acceptance of digital healthcare, where we always thought that the people might not actually adopt to healthcare, but when you saw during COVID, telemedicine picked up to almost like 5 times what it was pre-COVID. Those were the days I was working with Practo, and I could actually see the jump in teleconsultations which happened during COVID times. Especially in specialities like dentistry and appointments have also taking appointments has also been become very easy. People are getting used to using mobile health applications. You see so many people around you wearing smartwatches, tracking their sleep, tracking their blood pressure. These wearable devices have become very common. Patient portals like Practo, which I said, help you take appointments. Many specialties like dentistry, dermatology, ophthalmology, super specialties like optional surgeries, they are now heavily dependent on Practo to get their patients, because many patients would actually search and book these non-urgent care via such patient portals. EHRs have become very common in most hospitals. CDSS is clinical decision support system, which are a part of EHRs, which help doctors make decisions are very easy. My last company was working in digital therapeutics, where we were providing care to patients at home using technology and AI and mobile apps. So all in all, I would say that what we see today in healthcare, how patients are expecting healthcare to be given, and how actually doctors are providing healthcare has changed drastically over just the last 5 to 10 years.
Yes, I think that is so fascinating, and just with after COVID, the shift to digital health has become very smooth as well, I would say, and people are starting to adapt also. But while potential of digital health is undeniable, of course, so adoption in clinical setting hasn't always been so smooth. So, what do you think are most significant barriers healthcare professionals face when trying to integrate these solutions into their practice?
The first time I heard of these barriers was when I actually started getting into this health tech world. So that was around 2003, 2004, and the barriers haven't changed. Maybe the height of the barriers has slightly reduced, but the barriers remain the same. And the number one barriers I've seen, especially in clinical settings, is the resistance among doctors and other healthcare professionals in actually adopting these digital methods. Uh, they're probably more scared of using new technology and very much set in their own ways on how they have been delivering care for so many years. There have been surveys which say that more than 60% of the doctors would prefer to give healthcare the old traditional way rather than adopt digital technologies. Also, there is doctors and other healthcare professionals whether these digital solutions actually do work as good as they advertised. And there's another fear that these technologies might bring about a kind of a reduced interaction between doctors and patients, which might break the doctor-patient relationship. These are some of the few challenges I see among healthcare professionals.
Yeah.
There are other challenges. There are really many other challenges. This from doctors का resistance ये तो एक हुआ. Affordability. Many times use of technology might, which it shouldn't be, but it does make sometimes healthcare more costly for some of them. Nurses, doctors are not really trained how to use these technologies, which causes them to use this technology either less effectively or not use it at all. There's low level of awareness. These are some of the challenges which I see in adoption of technologies in healthcare.
Yes, I think you also mentioned about adoption. You also mentioned about something about the healthcare, not some healthcare professionals' difficulties in adoption also. So one more question is what if what happens in rural parts of India or any part of the country? How do you think the healthcare professionals there can adopt to digital health technologies?
See, almost every doctor I know is already providing consultations via WhatsApp. Okay, so it could be rural, it could be urban. The base level of telemedicine, as we might segment it, is already happening. What has taken time to happen is adoption on a wider scale, where a whole group of doctors or a whole hospital or a maybe a primary health center or a community health center or a block hospitals adopt technology in providing care. It didn't happen for a long time. We were doing it. But now, since the last few years, with government coming out with things like the ABDM, the digital mission, and softwares like e-hospital, which is completely free of cost, which not just lets, now it has been made mandatory in many states that software like e-hospital or other comparable softwares have to be used by the hospitals so that the data can be centralized and the data can flow back to the central government, which helps them make decisions on how to spend the public health money. So there is resistance. I have talked to so many doctors who work in the rural areas, but I guess the new regulations and the whole compliance ecosystem has made it mandatory. So it's come, and you just have to adapt to it, get yourself trained on how to use it, and do it.
Yes, I think that's right. Now, also, Doctor, another key aspect of this transition is education. So, what role do you think education and training play in preparing healthcare professionals for digital health transformations? And are we doing enough in this area?
Like I said, now the first highest barrier to adoption was this fear and skepticism amongst doctors. How do you get rid of it? Education and training is the only way you can get rid of this inertia amongst doctors and actually using these tools. In fact, the national education policy itself mandates that these kind of tools are taught in medical schools. There are online courses, virtual labs. There's so many ways of learning which have now been introduced in many hospitals. My college, AFMC, now uses a lot of technology. AIMS Delhi is very popular. It just had a 300 crore budget for using AI. A few days back, they were given a good budget for it. So this kind of education and training right during medical college and medical school days is kind of fundamental in bridging this knowledge gap that doctors have in how they can best use technology. Then there are many public-private partnerships. Like if you look at IIT Bombay, they've got together with the Koita Center for Digital Health, and they're providing one-year courses in actually training these doctors once they come out on how to use digital health the best way. There are you will find many similar courses in IIMs, IITs, where they have actually gone forward and created these courses. ISB also, I know, has created a course. The National Health Authority has also partnered with the Maharashtra University of Health Sciences to provide such postgraduate courses in digital health. While there are so many courses, I guess this collaboration of public and private partnerships and actually getting digital health as early as possible in the medical curriculum is the best way to train these doctors and get them ready this world of today on how to provide healthcare much more effectively using technology.
Yes, I think it's so interesting to know how actually medical colleges are also incorporating digital health tools as part of their curriculum. It's really interesting to know. So now, Doctor, an important point that is often overlooked is inclusivity. So digital solutions can often sometimes, inadvertently exclude certain patient populations. So what measures do you believe healthcare providers should take to ensure these technologies are accessible to everybody?
Every doctor has his own patient segment they work with. Okay, the kind of patients I work with in Bangalore would be very difficult from the kind of patients my friends work in rural Rajasthan. So there is no one thumb rule for how to increase accessibility. Different patient segments have different needs. It's up to a doctor to understand how literate his or her patient segment is, and then use technology the best way which suits his or her practice. So there are no thumb rules for that, but I can give you certain pointers. Affordability, we already talked about. Certain therapies are technology-based therapies are not very suitable for certain people who cannot afford them. Accessibility. So now there are worldwide guidelines on how to make your applications or your programs much more accessible for people with visual disabilities or reading disabilities. So those kind of guidelines need to be followed. The kind of screens to be used, the kind of fonts to be used, the color combinations. So these are certain worldwide guidelines. Nothing difficult about it. But when doctors work with these developers to actually create programs and software for their own use, they need to keep this in mind that not everybody is the same, and you need to be able to cater to all kind of able, disabled, and partially able people. Language barriers, cultural barriers. You should be able to provide your healthcare. If you're using mobile apps, use the language of your region. Do not exclude people who cannot speak English or Hindi, which I see very often. I've seen great apps, great user design, but only in English. So they automatically exclude 70% of the population who live in tier 2 or tier 3 cities who are more comfortable in the local language. So and you have apps which say, mention your symptoms. No one would understand what the meaning of symptoms is. So use the correct language as per the geographical place where you are. Doctors might also have to provide some of digital support to their patients, actually teach them how to use these tools. They shouldn't shy away from that, and actually help their patients use these kind of tools. Use tools which can be used across multiple devices, not just laptops or desktops, mobile apps which can be used on smartphones, tablets. There are certain devices which are used. So get it inclusive. Do not leave any language out. Do not leave any geographical area out. Do not leave the disabled out, and do not leave any device out. Include them all. This is some of the fundamental things I would say.
Making it user friendly is like very important. One more question that was just coming into my mind was, doctor, while building such apps or such digital health tools, what role does multidisciplinary team plays, like when including healthcare professionals or some engineers or some software developers, something that you can think of?
Oh, yes. So I've been working with multiple multidisciplinary teams for a long time now, where my team would usually consist of a medical lead like me who would give the clinical background to what I need. Then these developers, they come back to you with possible solutions. Now, then a clinician has to look at, does the flow make sense? Does the process that they have designed make sense? Once they decide on, yes, this is the flow and this is how things have to work and this is the technology on which it will work, then you have product managers who actually design the product and the interface. So this is how you work. You need a clinician there to kind of make sure that the clinical parameters are being followed and your clinical endpoints are there. Actually, every device, every program you make, it has one singular objective: to improve healthcare outcomes for the patient. Finally, patient has to do better than he was doing without the technology. And to do that, it's just not a doctor. You need a whole multidisciplinary team where you work with the designers, with the developers, with the product managers, helped by a medical person to create any kind of program like this.
Yeah, that is really important, I feel. Now, doctor, switching gears slightly, let's talk about AI in healthcare. So while it's a powerful tool, it's not without any limitations. So what are some of the key limitations you see, and how can we strike the right balance between technology and human expertise?
Yeah, this is the big buzzword now, right? AI.
Yeah.
In fact, people have rebranded their old tools, which were based on inference-based engines, where you had algorithms with this and this, so it's this and this is. People have rebranded the very same thing into AI and putting it out because it's the buzzword right now, right?
Yeah.
But AI is much more than that. It's much more different than that.
Okay.
While I will not go into explaining the details of how AI works, I'll tell you a few things where people have to be very, very careful when they use AI. See, AI is based on the data that you already have collected over the years, which is then, uh, and then you feed in new data of your patient, it analyzes and kind of looks at the trend of your patients over the years and matches and kinds of tries to predict what might happen in the future and what can be the best way to get there. All this training is done on the data that you have. So obviously, the first problem with your AI would be if the data is not good and it's biased, then your AI will not work, right? So it is how clean and how accurate your data is. You must have heard of all those things where when black people are always shown as criminals in this AI
Uh,
thing. Why is that? Because that is what we have been doing for so many years now, and that is the data you put into your AI. So your AI will think exactly the same way that you have been doing over so many years. So this bias in data and this bias in how you have been behaving all these years will always transform into your AI also. So be careful of that. That is one. Second part about AI is the use of is the issue of privacy and security. See, there are big companies like ChatGPT which have provided the base engine on which you can build tools using your own data, right? So the base engine remains there. But you have to understand that you are feeding data into this base engine, which can then be used across various applications. Getting your data is very important. Not all hospitals or organizations have the capability or the money to make their own base engine and then work on that so that the data remains within the organization. That is just not possible. You always use a third party engine or a third party base model and then work on that. So that this data privacy and this data security is going to be very important. Another issue with this using of AI is what we call that black box. Many times we feed in data and questions, and the answers which come out have nothing to do with what kind of data you have fed in. You do not understand how did this AI come from this question to this answer, and nor can the AI explain that. You're not sure if the AI is actually hallucinating, and there is actually no connection. So this issue of no explanation given uh, in a field as sensitive as healthcare, where you might actually kill a person if you do not know what exactly you're doing. So if I can't actually trust an AI blindly uh, and work on that, and that I shouldn't anyways. This human in the center is very important. So these kind of things, and then you have things like lack of empathy. So as a doctor, I know what kind of words and what kind of tone to use when I talk to a patient. And unless you actually specifically build an empathy into your AI, you run a chance of coming out as kind of mean and cruel. So these are some of the things which show us that as of today, we cannot trust AI blindly. Have a human in the loop, have him or her use the AI. Today, I would say keep the human in the loop and have the final decision to be taken by the doctor to actually use these AI suggestions.
Yes, I think there's always said that there's something that human cannot be replaced with either AI or any robot. So this is
Yeah,
really true, I feel, especially in healthcare where
correct.
everything is really
Correct.
sensitive as well. So, Doctor, finally, if you were to advise healthcare professionals as an expert in this field to adopt one digital tool or strategy immediately into their practice, what would it be and why?
I would advise these professionals to actually look at what their patients are looking for and then use that technology. See, the buffet of technologies and tools that you have in front of you is almost endless now. So, for some doctors, simply using a chatbot on their website or on having a chatbot even within WhatsApp created specially for them is the best tool that they can use. There are certain other doctors like general practitioners or family physicians who practice across a wider geography. For them, telemedicine might be the best tool. There are some hospitals who might kind of have the best results by using a advanced hospital management information system, which is integrated with ABDM, so that they can actually work with the government on larger projects. So there is no specific tool that all of them should actually use, but anything which helps your practice personally, and you can see a better patient outcome by using that practice. It could be telemedicine, it could be tele ECGs, it could be higher end EHRs with a clinical decision support system. So I think it would totally depend on what kind of things you do. You might even have create specific apps for patient engagements. There are wearable devices which monitor your heart health, which have shown to reduce readmission of heart failure patients by as much as 50% to 70%. So for a cardiologist who works extensively in chronic care like heart failure cases, for him, remote patient monitoring would be the best technology. So I would say choose as per your specialty and the kind of patients that you have. The goal is better efficiency and better care. Whatever works for you is the best.
I agree to that. I think everybody also has different needs and requirements also based on their tailored to especially to their specialty also. So, Doctor, as we wrap up today's session, thank you so much for sharing your insights on this important topic. And I think it is so clear that while digital health is a powerful force for good, navigating its complexities also requires strategic thinking, inclusivity, and also commitment to education. So, thank you so much for sharing that with us.
Thank you, Hetvi. Thank you for having me. It's been a pleasure talking to you. You let me say some things which I might have not have said very easily in a public setting, because like you said, doctors are not very comfortable talking about technology publicly. So great. Thank you for inviting me.
Thank you so much. And we look forward for more discussions as well, Doctor.
Go ahead, anytime.
And to our listeners, we hope you've enjoyed this discussion as much as I have. And if you are inspired as I am, take a moment to reflect on how digital health can play a role in your practice or personal health journey. So, thank you for being part of this conversation. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, keep learning and take care of your health.